Good evening and welcome to an Eyewitness News special, the coronavirus in Connecticut. Doctors answering your questions. I'm Kara Sundlun. Throughout the next 30 minutes, we'll be hearing from health experts from Hartford Hospital as they answer the questions that you, our viewers, have asked the most. So as we get adjusted to this new normal, people should not be afraid to seek medical care or visit the doctor. First up in our coronavirus in Connecticut special, the President and CEO of Hartford HealthCare, Jeffrey Flaks. Thank you for being with us.
Oh, thank you. Good evening, Kara.
Good evening. You know, it's a question that's on everyone's mind as the state starts to reopen. How safe are we? Did we really flatten the curve?
Well, fortunately, the curve has flattened. We're about 55% below our peak of where we were in terms of treating COVID patients. So we've seen a very significant decline, which we're very grateful for. And we're seeing both the testing in the community to be fairly consistent and at a fairly low level of prevalence. So we're encouraged by the results, but we're monitoring it very, very carefully.
People are still nervous about going to the hospital. How have the hospitals emerged from the pandemic?
Kara, first of all, I'm so proud of the way all of our hospitals in the state have reacted and managed this crisis. You know, our gratitude to our frontline healthcare workers could not be greater. Everyone who's worked within our facilities, from our physicians, nurses, respiratory therapists, to all people working in support services and invaluable services like housekeeping and food services, they've been so careful, so attentive, and so brave and courageous in doing this work. But our hospitals are safe. In many ways, I describe them as the safest place to be anywhere within our community. We've put so many precautions in place, from visitation policies to screening every one of our staff members and any person who enters one of our buildings, to testing all people who are getting surgeries within our facilities. So many precautions, a focus on safety, on ensuring that we're here to take care of our community and under all purposes for, at any point in time, for all reasons.
And we definitely do want to thank everyone on your staff. They really have been the heroes, and I know they've had to deal with things they never imagined they'd have to deal with. We've been talking for weeks, Jeff, and I know you wanted to talk about hospitalizations going down, and they have. That's a key metric. But a lot of our viewers keep asking, but what about the fact that deaths and cases still continue to go up?
Well, this virus has been a deadly virus, and our hearts go out to the people who have had losses within their families, with their loved ones, within our community. There's been a mortality rate of close to 20% across the board for people admitted to hospitals. But thankfully, the vast majority of people have been treated at home by their primary care providers. And for the people who've been admitted to hospitals, about 80% are successfully being transitioned back to home, and they've beat this virus. So we've really celebrated the so many brave people who have come into the hospitals and left really very well. So it's really been a tremendous journey within our hospitals to care for people under such intense conditions.
And I know that the deaths always trend after we see the hospitalizations go down. But when you talk about testing and contact tracing, how important is that going to be as we move into the next phase?
Testing's critical, and I'm so pleased. First of all, there's more testing today than there has been at any point in time. We have 9 testing centers set up across Connecticut. We also have a mobile testing center, a pop-up center. So we're testing in churches in the community, community health centers. We're testing nursing homes. We're testing homeless shelters. We're testing the Department of Corrections officers today for the state and other first-line responders. So testing is critical for us to preserve a safe, secure environment across Connecticut. Testing and monitoring prevalence is very critical.
Should everyone at this point get tested, even the asymptomatic?
Well, over time, that's going to be evaluated. But today, testing is accessible. So people can get a test. They don't need a physician order when they don't have one. We have a mechanism to provide them an order from a practitioner so that they're eligible for the test. So we're removing all barriers to testing. And many more people are getting testing today by virtue of self-selecting or attending any one of our drive-up locations or our pop-up locations when they're being advised by their provider or they feel it's appropriate based on their circumstances.
And a final question for you, Jeff, is that we know that telehealth visits have skyrocketed. Is that going to be the new normal? Would I, in the future, go to the doctor on Zoom?
You know, Kara, I keep describing everyone wants us to return to normal. And in many ways in our lives, we all want to return to normal. But I have to tell you, in healthcare, I don't want us to return to normal. I want us to be better than normal. This is one of those great examples. Telehealth is a game changer. We have done 141,000 individual patient telehealth and video visits. And what it allows us to do is we now have specialists that may not be in a certain location at a certain point in time in the state, but through telehealth, we're able to make it available 24 hours a day, 7 days a week. So it's about access, and we're providing our expertise more places, more reasonably, and more accessibly. So this is an important thing, and I hope it's going to emerge as we evolve now as one of the standards of care as we go forward. And it's an important part of community health and wellness.
Thank you, Jeff Flaks, CEO and President of Hartford HealthCare. I know you just launched a 24-hour mental health hotline. We have much more on that coming up in our special tonight, but we want to thank you for being with us.
Thanks so much, Kara.
We do have much more to come on this coronavirus in Connecticut special. After the break, we are answering more of your viewer questions right after this.